Hello, this is Daniyal Ultrasound Clinic, Dr. Munir Abbasi. Today, here is interesting case, the case of growth in the urinary bladder. On today's ultrasound case, we have a growth visualized over the left lateral wall of the urinary bladder. The mass appears irregular and echogenic, projecting into the urinary lumen, which raises strong suspicion of a urinary bladder tumor. Here is the real time. You see, this is urinary bladder showing slightly echogenic, irregular, immobile structure which is adherent with the lateral wall of the urinary bladder. Now, how to describe it? Actually, patient is complaining of hematuria with sometimes turbid urine. So when we move the patient passively, this mass doesn't move. So this is immobile mass present or occupying the left lateral wall of the urinary bladder. So this is suggest indicative of growth. There are no other echoes or sign of clots in the urinary bladder. Now let's go to the kidneys. We have to see whether if there is any obstruction or not. So Baba Timukyo, pass over. Yes, the left kidney here you see this is left kidney showing signs of obstruction. Here is the left ureter which is dilated also. So this obstruction is secondary to the growth present or occupying the left lateral wall of the urinary bladder as well as left vesico-ureteric junctions. So this kidney is also enlarged and showing mild to moderate hydronephrosis or pelvic dilation. Sudochi Baba. And to the right kidney, here is the right kidney which is showing also slightly dilated pelvic calyceal system, but this is insignificant because this is due to the overdistended urinary bladder. However, left kidney is definitely showing obstruction secondary to the growth present in the left lateral wall of the urinary bladder. This is the right kidney which is also showing cyst, simple cyst, and occupying the middle part of the lower pole, also a stone in the lower pole. And this kidney is also showing chronic renal parenchymal changes with thin cortex and grade 1 echo pattern. This is liver again. This is your gallbladder, which is also normal. But the most important thing I wanted to share in this video is the growth which is occupying the left lateral wall of the urinary bladder, and it measures approximately 7.4 into 3.3 centimeters. So other findings, other things we have to watch here are whether this growth is invading the wall and going through and through. So there is no such evidence. This growth is limited to the wall, although there is slight irregularity here, which shows that growth has started invading. Sorry. So there is invasion of the growth into the urinary bladder wall as well, and further patient has to undergo investigations like cytology, cystoscopy, and contrast CT urogram to confirm the diagnosis of the staging of this growth. And thank you very much. That's all from my side. Thank you.